My relationship with Rush began when I was 23. We lived on the North Shore, and I was walking home from class, and I realized that I was having a problem breathing. And it hurt to take a breath, not just a deep breath, but a breath. And I told my husband I need to go to the hospital. I was put in the hospital for 2 weeks, diagnosed with sarcoidosis. And that lasted several years. And while I was on medication for sarcoidosis, I graduated from college and started working at Internal Revenue. So the doctor knew I had had that heart murmur since I was 23. But what was said was, eventually we're going to have to replace that. So I thought when I got sick, really sick after my husband had died, that I have to go in the hospital and have this valve replaced. I called myself getting ready to go to the laundromat. Separated all the clothes, got them ready to go. Went to the bathroom, changed my clothes out of my pajamas, came out of the bathroom and said to my kids, I need to go to the hospital.
I first met Wadeane while I was on service in the cardiac ICU. We accepted her as a transfer from Rush Oak Park Hospital, and then we cared for her, got to know her, helped to treat and get her the treatment that she needs. And she had a prolonged hospital course due to her multiple medical issues, but ultimately I'm able to now see her in the office where we're establishing an ongoing relationship. So Wadeane was being followed and treated medically for her other medical conditions such as high blood pressure and diabetes. She had a long-standing history of sarcoidosis, which was not currently active. So she was developing shortness of breath over the last few months leading up until her condition necessitating a trip to the emergency room at Rush Oak Park. And while she was there, the diagnosis was officially made that indeed her aortic stenosis had gotten worse, and more importantly, her heart muscle function had really dropped off and declined a lot quicker than anyone had really expected. So the cardiology team and the medical team and the nursing team over at Rush Oak Park took great care of her, stabilized her, got some good diagnostic testing done, and then we were able to transfer over to the main campus where we were able to use our resources here, continue the team approach. So now we have two very significant problems. We have a narrowed or stenotic heart valve and multiple blockages. We consulted with our cardiovascular surgeon colleagues, talked about her case in a multidisciplinary way, and deemed that ultimately she should undergo heart surgery. They were able to actually take out the old, degenerated, poorly functioning valve, replace it with a brand new valve that is made out of bioprosthetic or man-made tissue mounted on a valve. So it's basically a new valve where blood can flow freely. Not only did they replace the heart valve, but the cardiac surgeons are able to do a bypass at the same time. With that surgical approach, he actually recovered her heart muscle function to almost near normal, which is a very dramatic improvement, and we were very happy to see that.
I think it's great that my heart function is back to before I was really sick. I was very active, and I've tried to be active again. I don't get tired as easily anymore, and I was always tired, constantly tired. I'm 70, I take naps. But there are things that I want to do, like I do go visit people.
She made progress every step of the way. She eventually, once we were able to, take care of her up in the cardio science unit where we worked together with the surgeons and the nursing team, we were able to get her over to the Bowman Center, which is our inpatient cardiac rehab, and it allows people to get their physical strength back, their emotional well-being back, and just give them the confidence to know that the worst is behind them. They can go on and live a normal, healthy life. And she's doing quite well now, and we're just delighted with her progress.
I have always had good care at Rush, always. Matter of fact, I wrote about it on Facebook. I said, I want to thank everybody, and anybody who reads this, I want them to pass it on if they can. because I was in here for a while. And from the cleaning staff, the people in the kitchen, the dietary needs, the doctors, the nurses, the techs, everybody, I felt well taken care of. I felt it was one of the best experiences in a hospital I had had.
If you're having any symptoms of shortness of breath or chest discomfort or just not being able to do what you used to do and it just doesn't feel right, please seek medical attention. A lot of the medical conditions we treat, if caught early, can be treated in a less invasive way or before significant damage is done.
They did a wonderful job. I am in good shape. My husband died in August of 2020. April of 2021, I had open heart surgery, and my kids did not have to go through losing two parents in the same year.